Missouri Cancer Registry is in the Department of Public Health under the College of Health Sciences. The ultimate goal of collecting cancer information is to prevent and control cancer and improve patient care. This presentation is on quality cancer data. My name is Lucinda Ham. I am the Operations and Quality Assurance Manager for Missouri Cancer Registry. I have 34 years of experience in the hospital setting and have been with Missouri Cancer Registry for the past 4 years. In my hospital experience, my main job was coding and departmental supervision. Cancer Registry fell under the departmental supervision portion of my job. I was at Hannibal Regional Hospital when I was first introduced to the Cancer Registry in the late 1980s by the Missouri Cancer Registry training team. That was back in the day of abstracting cases on paper and mailing them to the Central Registry. During my time at Audrain Medical Center, also known as SSM St. Mary's Audrain, I wore many hats with coding, supervising, and ensuring the Cancer Registry met the Commission on Cancer standards. Cancer Registry is a great option for HIMers because we are all so used to paying attention to detail and monitoring data quality. I would like to acknowledge that Missouri Cancer Registry and Research Center is housed on the campus of the University of Missouri in Columbia, Missouri. The Missouri Cancer Registry and Research Center is supported in part by a cooperative agreement between the Centers for Disease Control and Prevention and the Missouri Department of Health and Senior Services, and a surveillance contract between DHSS and the University of Missouri. And Missouri is a research state for SEER. The objectives of this presentation are to learn about the following components: Cancer Registry definition, data quality standards by the National Program of Cancer Registries, the importance of timely cancer case reporting, Cancer Registry reporters, death and pathology cases used to create incidence cases, case prepping and consolidation, audits performed at the Central Cancer Registry, resources used for abstracting cancer cases, education provided by Missouri Cancer Registry, and cancer incidence data at the state and national level. Cancer Registry definition. The Council on Certification at MCR defines the Cancer Registry field as a collection, management, and analysis of cancer incidence data for the following purposes: research, quality management or improvement, cancer program development, cancer prevention and surveillance, resource for survival and outcome data, compliance of reporting standards, and development of accreditation standards for Cancer Registry. Quality cancer data. What makes up quality and completeness of cancer data? The majority of cancer case reporting is from hospitals, physicians, oncology centers, surgery centers, and nursing homes. Electronic path lab cases are funneled through the Department of Health and Human Services to MCR. Death clearance cases and complete race and demographic information is obtained by linkages with state and federal agencies. Audits are performed by the Central Cancer Registry to ensure the data collection items are accurate and complete. Education is provided to reporters via submission feedback, NASAR webinars, YouTube videos, Show Me tips, and so on. We will cover how the data is used in the last portion of this presentation. Let's review some background information about the collection of incidence data. Cancer incidence data are from central registries participating in the Centers for Disease Control, CDC, National Program of Cancer Registries, MPCR. MPCR is funded by the CDC, or from the National Cancer Institute, NCI, Surveillance, Epidemiology, and End Results Program, SEER. NCI funds SEER, so states have two options of participation. They are either an MPCR state or a SEER state, and some are actually both. Missouri is an MPCR state and a SEER research state, which means we follow the reporting guidelines for data collection items for MPCR and report data upon request to SEER. MPCR receives data from 50 central registries. SEER collects data from 22 U.S. geographic areas. Cancer incidence data is collected from medical records and abstracted by ODSs. Both MPCR and SEER require CCRs to use uniform data items and codes as outlined by the North American Association of Central Cancer Registries, also known as NACER. MPCR-NACER Quality Data Standards. These are the timeliness and completeness standards set forth by the National Program of Cancer Registries, MPCR, and the North American Association of Central Cancer Registries, NACER. Missouri Cancer Registry is required to meet these standards to receive the gold certification. This year, we are required to meet 90% completeness for 12-month data, which is the 2024 cases. As you can see, demographic data is extremely important to us. We are finding more and more that hospitals and physician offices do not collect race information. County information is sometimes reported with an unknown value. The 24-month data has to be 95% complete based on observed to expected cases computed by the CDC. Less than 3% can be death certificate only cases. We cannot have more than 1 per 1,000 duplicate cases in our database. The maximum percentage of missing critical data elements includes less than 2% for age, 2% for sex, 3% for race, 2% for unknown county, and 99% of cases must pass CDC computerized edits. The 12-month data is less stringent because it's less complete. Data must be 90% complete compared to 95% for 24-month data. 5% or fewer of the cases can be death clearance cases. 3% or less cases can be missing age and sex. 5% of cases or less can be missing race information, and 97% of cases must pass the CDC computerized edits. Timely reporting. Power BI is MCR's tool of choice for tracking timeliness and completeness. We monitor the reporting status of facilities by the month and annually. We are currently monitoring 2023 and 2024 cases very closely to ensure we meet the benchmarks set forth by MPCR and NACER. Our informatics team is working to connect Power BI with our database and have real-time data rather than at a month's end. We can see trends in reporting and MCR processes by using Power BI. For example, this graph shows our turnaround time for processing incoming files, the number of files submitted to us by reporters for the month, and how many cases we have in our database for the year. Status letters are sent to reporters several times a year, which contain the number of cases submitted and the percent completed based on past submissions. Gold certificates and congratulation letters are sent to facilities who report every month or quarterly as required and complete 95% of cases within the required time frame. In 2024, we had 27 facilities receive gold certificates. Those reporters were able to share the letter and certificate with their administration. Some were actually given a CARES Award for their timely reporting and their efforts in the Cancer Registry. MCR by the numbers, fiscal year 2024. This slide shows our current files processing time from the time the files are submitted to MCR to the time they are imported into our database. We have reduced this from an average of 23 days in 2022 to 8 days in 2024. So, as you can see, the average number of records processed per month is 6,800. The total number of records processed in fiscal year 2023 was 81,600. We have less than 1% of cases in our database left to be consolidated. The average number of files submitted per month is 94, and the average number of files processed per month is 95. So how do we get cases? MCR gets cases from a variety of reporters. As stated previously, the majority of our cases come from the hospital reporters, 91% actually. 3% come from outpatient surgery centers, 2% physicians, 1% death clearance, 1% path lab, and other cases come from linkages and inter-registry data exchange. And remaining cases are from oncology centers, laboratories, nursing homes, and hospice care. Abstracting cases, low-volume facilities, and non-hospital reporters. WebPlus, which is our internet-based program, is now used for low-volume facility and non-hospital reporting. MCR onboarded 5 physician groups, 2 oncology centers, and converted 9 low-volume facilities in 2024 to abstracting cases in WebPlus. All facilities will be required to submit cases electronically by the end of 2027. We try to make the abstracting process as easy as possible by creating abstracts specifically for dermatologists and urologists and other low-volume reporters. For example, we created a limited abstract for our small hospitals to complete, and we finished the abstracts based on information in the text fields. This is an example of a WebPlus abstract for low-volume reporters, small hospitals, and physicians. As you can see, the user has limited fields to complete. We ask the reporter to include pertinent text so the abstract can be completed by a Central Registry reviewer. The arrows next to the fields are drop-downs, and the question mark bubbles contain specific instructions on how to complete each field. Critical fields are identified by an asterisk. Those fields must be filled out. In most cases, abstractors have the ability to copy and paste pertinent information from their electronic medical record. WebPlus abstract edits. Once the abstractor completes as much information as possible, they have the option to check for edits. The edits will indicate which fields need correction. In this example, the abstractor would click on Text, Physical Exam, which will move to that section of the abstract for the abstractor to fill in the information. Once they have completed everything in the abstract and passed edits, they may release the abstract to the Central Registry for review. Abstractors are allowed 60 minutes to complete an abstract. If they click Save, the clock starts over. We encourage abstractors to save frequently to ensure information is not lost in the case of interruptions. One of our reporters are the path labs. All path labs must abide by the same reporting requirements as other types of healthcare facilities. Electronic path information is imported daily into MCR's eMark Path Lab software from DHSS. This information is not equivalent to a full abstract. Most of this information is missing demographic data. A MCR staff member reviews imported cases from certain labs and removes non-reportable cases to ensure those cases are not imported into our database. MCR imports an annual average of 700 path lab cases out of a potential 12,000 cases. These cases were not reported by anyone else. Python and Excel is used to clean the cases by adding default data. Examples include surveillance-only prostate cases, melanoma cases, etc. And this process also identifies non-reporters. Death clearance, adding final information. This process adds over 1,200 cases to our database annually. So what is death clearance? It is the process of matching registered deaths in a population against the Cancer Registry database. It improves registry data quality and completeness with use of official mortality files and death certificates to update cases with death information and identify previously unreported cases. It's also used as a measure for data quality by national standard setters such as NACER, CDC, and SEER. MCR follows guidelines per the NACER Death Clearance Manual, the minimum requirements and best practices for conducting death clearance. In addition, deaths from the official state mortality file are linked to the MCR database to identify records that match and those that do not match. Each patient match is updated with death and other relevant data. Records with a cancer diagnosis that did not match the MCR database at the patient level must be investigated. MCR contacts facilities for information confirming a reportable cancer diagnosis or a potential missed case that will be completed and submitted to MCR by the facility. If no information other than the death certificate is found, the case remains in the registry database as a death clearance only DCO case. The national quality standard for death clearance only cases is less than 3% annually. MCR continues to meet this goal. MCR has a death clearance YouTube video available on the website, which contains instructions for processing death clearance cases. Interstate data exchange and linkages. Missouri exchanges data twice per year with 33 states. This information helps us complete our information in our database by adding demographic and other cancer information. Linkages are performed annually with other organizations such as the Social Security Administration, Breast, Cervical, and Cancer Control Program, BCCP, National Death Index, and the Indian Health Services every 5 years. Case prepping and consolidation. So I bet you are wondering what happens with the 80,000 plus cases that are reported to MCR annually. MCR has a process of prepping cases that are submitted to the registry. This is basically cleaning up edits and adding default data to out-of-state files. For example, Missouri collects alcohol and smoking information, whereas other states may not. After the files are cleaned, they are imported into our database. Some cases are added directly to the database, where others go in as pending cases. The pending cases must be reviewed to determine if they are a new tumor for a patient or if they need to be consolidated with the same tumor reported by another facility. The MCR QA team reviews the cases, saves the best and most accurate information from each reporter to create a quality surveillance case. At this point, I want to emphasize the importance of complete patient demographic information. For example, patient race, address, and social security number are a must for accurate consolidation of cancer cases. County information is important in identifying increased cancer risk in certain areas of the state. Additional information such as smoking and alcohol history help researchers understand the impact of unhealthy habits and cancer risk. Insurance information is important because it can identify trends in cancer identification and treatment delays due to no insurance. Some patients must wait for Medicare or Medicaid approval before beginning any type of treatment. Feedback to reporters. The MCR QA team reviews cases reported and provides feedback to reporters in Excel spreadsheet format. The MCR QA team is required to clear all edits on the cases prior to importing into the database by using a software called Prep Plus. Some cases may be rejected and sent back to the reporter for review. QA reviews 10% of all cases in every bundle submitted. Reporters can make corrections in their own databases based on this information. If the reporter does not agree with QA, the case will be investigated further. Audits. Missouri Cancer Registry conducts audits and is audited by our standard setter, MCR, every 3 years. Case finding audits. The National Program of Cancer Registries require that we do case finding audits in Standard 1.7. At least once every 5 years, MCR conducts case finding and re-abstracting audits from a sample of source documents for each hospital-based reporting facility. MCR performs several case finding audits per year. MCR updated the audit process using medical record disease indices in Excel format for comparing data items rather than manually reviewing data line by line. So let's review this updated process. The medical record disease indices needs to be in Excel format from the hospital. The MRDI is compared to the ICD-10 case finding spreadsheet by using the Match Excel formula. The cases with matching codes are then compared to the Central Registry database. For larger facilities, we may use MatchPro to facilitate the audit process. The comparison is completed using the application MatchPro, which is provided by NCI SEER. MatchPro serves as a records linkage or matching method that compares patient identifiers between two files using probabilities to determine if the identifiers match. Once the cases have been compared to the Central Registry database, the non-match cases or potentially missed cases are then submitted to the facility for review. WebPlus is used to communicate with facilities. The facility will review the cases and submit any that were truly missed cases. Abstracting resources. NACER, STOR, SEER, and the MCR Abstract Code Manual are the top 4 resources used by MCR and ODSs in general in Missouri. Registrars should take the time to check the resources when abstracting cancer cases. New registrars should take the time to read through the STOR manual at least once in its entirety. NACER resources. The NACER Data Dictionary is a reference tool used to ensure uniform data collection is performed by hospital and central cancer registries. Registry software vendors refer to the Data Dictionary when developing cancer registry abstraction programs. Each version contains revisions such as new data items, changes to existing data items, retiring data items, and updates to standard setter requirements. The implementation guidelines list all the changes for each year and reporting requirements. I usually create a new meta file at least twice per year, sometimes 3 if an error or discrepancy is found by the states or standard setters. NACER initiates the meta file and I add 11 Missouri-specific fields. These meta files are placed on the NACER clearinghouse for vendors to pick up and use to customize their software programs for each state. So what is a meta file? A meta file is a generic term for a file format. Each field has programming and edits attached. For example, if a patient's date of birth is typed incorrectly, the meta file contains edits that will alert the abstractor to correct the date of birth. ICD-0 3.2 Guidelines. In HIM, many of you are likely familiar with ICD-10, CM, CPT, and HCPCS codes. In Cancer Registry, we use ICD-03 and histology codes. The ICD-03 site codes are very similar to the ICD-10 codes with the exception of hematopoietic diseases. We do use an ICD-10 reportable list for case finding. The ICD-0 3.2 guidelines can be found on the NACER website. The 2024 update includes 3 pages of new or revised terms. Standard setter columns have been added to show which codes are required for each. For example, there's a column for SEER, MPCR, COC, and then Canadian Cancer Registries. Cancer Schema List, SSDIs, and Grade. The most recent SSDI manual was published in October 2024. What are SSDIs? SSDI stands for Site-Specific Data Items. SSDIs are based on the primary site, AJCC staging system, summary stage, and extent of disease. These data items frequently are related to the stage of disease. In ICD-10, they may be indicators for a cancer, such as an elevated PSA. For example, if the primary site is prostate, registrars collect Gleason scores in addition to PSA, which are related to the extent of disease. This site lists the current SSDIs for each primary cancer site and is also found under NACER. Type or click on the site for detailed information. A new schema site has been added specifically for pediatric cancer cases. GRADE defines cell characteristics and can determine how fast a tumor will grow. Hematopoietic and Lymphoid Database. The Hematopoietic and Lymphoid Neoplasm Coding Manual and Database is used for coding hematopoietic neoplasms. The database contains detailed information about each histology. Abstractors type in the histology code or name of the neoplasm to find specific information about a specific neoplasm, such as Hodgkin's lymphoma. Registrars should read the abstractor notes and follow the rules in the Hematopoietic and Lymphoid Neoplasm Coding Manual before using the Hematopoietic and Lymphoid Neoplasm Multiple Primary Calculator to determine multiple primaries. Hematopoietic neoplasms can be tricky because of the transformations that occur. For example, an acute leukemia can transform into a chronic leukemia. A myelodysplastic syndrome can transform into a leukemia, and so on. This is found on the CIR website in Registry Operations. Cancer Path Chart Initiative. The Cancer Path Chart Validation List is new and can be found on the CIR website. It is the 2024 ICD-03 Site Morphology Validation List. This replaces the CIR Site Histology Validation List. This is a basis for newly added primary site morphology and behavior code edits which check for valid, unlikely, and impossible site and histology combinations. Accurate site and histology information are essential for the evaluation, treatment, research, and surveillance of cancer patients. And here I've included the link to the Cancer Path Chart on CIR. Cancer Path Chart is a new table in version 24 that checks sites and histology for correct combinations. This new table contains over 122,000 rows. The status of 1 is a valid combination, status 2 means the combination is unlikely, and a status 3 is an impossible combination. An example on the left, COOO LIP, has histology codes listed that are valid for that site. On the right, the histology codes listed for the breast are identified as impossible by the number 3 in the status column. Edits will occur if the wrong site or histology combination is selected. This ensures registrars select the correct code combination. Training and education. Missouri Cancer Registry provides a mixture of educational opportunities, as you will see in the upcoming slides. Although it takes time, we place a lot of emphasis on education because we want the data coming into us to be timely and accurate. Educated ODSs or even non-certified registrars will do a much better job of reporting if they participate in educational opportunities and stay current with changes. MCR website. Our website contains a wealth of information. We are constantly updating and adding information. Soon we will have zone design cancer maps. Our website is also used for abstractors to access the WebPlus software for abstracting cancer cases. They can click on the yellow button to enter the program. WebPlus is also used by reporters to transmit cases to the Central Registry. Educational activities. This is the first MCR education page on our website. The NACER webinars can be found on this education page as you see here. MCR purchases the NACER webinars annually for our use and for the use of our reporters. Registrars are welcome to come to MCR to view the monthly webinar or can view at a later time by clicking on the link. Educational videos produced by the MCR team can be found on the MCR YouTube channel. In addition, we publish a monthly newsletter, quarterly Show Me tips, and many other informational items under Data Publications. On the next few slides, we will review courses MCR has available. Fundamentals of Abstracting. The Fundamentals of Abstracting course was created during COVID and resides on the MU Canvas platform. The course is geared toward new and potential oncology data specialists. This course is a great way to learn the basics of cancer abstraction. The course is updated annually as changes are made by the standard setters. We have had great success with this course. The participants are from all over the United States and some from other countries. The Fundamentals of Abstracting course can be found under Training and Online Courses. Mood Study Guide, Missouri ODS. MCR is now responsible for updating and sending out the former MOSTER Study Guide. The new name, MOODS, stands for Missouri ODS Study Guide. We have developed an online corresponding course and quizzes to go along with the study guide. Anyone who purchased the study guide will receive free online access to the quizzes, which can be taken repeatedly. This course can also be found under Training and Online Courses. MCR ODS Shorts. These are new in 2025. MCR is continuously adding courses to the Canvas platform. The MCR Education Shorts contain short educational presentations on various abstracting and cancer registry topics. The MCR Education Shorts are free to viewers. These courses will be expanding over the next few years to include more courses geared toward cancer registry. MCR has a YouTube channel. We create approximately 3 videos per year. We most recently posted a presentation on coding hematopoietic neoplasms. As you can see, the videos vary in presentation time. Some are longer, but most are around 20 minutes or less. These videos are created based on the need or request for more education from ODSs in various settings. MCR also has a LinkedIn and Facebook account where we actively share and post information. Quarterly Show Me tips are published monthly by the MCR staff and are included in the monthly newsletter and on our website. The Show Me tips contain important coding information on sites that are noted to be more difficult to abstract. So as you can see, this year we've done colorectal, liver, bile ducts, and vulvar cancer with HPV. If the MCR QA team sees a particular trend in coding a data item incorrectly, we like to address it with an abstracting tip in the monthly newsletter. An updated ODS training guide titled Grow Your Own ODS can also be found on the NACER website. The training in this guide is based on the SEER training modules. This is the website for the SEER training modules referred to in the NACER Grow Your Own ODS manual. Students and registrars can select a site to review anatomy. Hands-on exercises and quizzes can be found on SEER Educate. Now we will discuss how the data reported to Missouri Cancer Registry is used. The data has many uses. Cancer registry information is essential for determining and deciding where cancer screening programs and diagnostic and treatment services are needed. Data shows areas of cancer incidence per a population group, such as a county or state, which may reveal trends in cancer incidence that may need further investigation. Once the data reaches the state and national level, it helps the public health officials prioritize and monitor public health efforts and track progress toward the Healthy People 2030 goals. Cancer incidence data is frequently used for research studies in an effort to improve patient outcomes. After MCR reports data annually to MPCR and NACER, the data is combined with that of other states across the country to develop the U.S. Cancer Statistics. The U.S. Cancer Statistics Data Visualization page is a method of researching cancer information in the United States and Missouri. Missouri data can be compared to other states. Reports can be run by geography, trends, stage, survival, prevalence, and screening risk factors by clicking on the tabs. The data was recently updated to include 2021 stats and should be updated to include 2022 stats very soon. I know you're probably thinking this sounds like old information, but if you consider the time it takes for reporters to get the information to us, and then we report it annually, it is nearly 3 years old whenever it's made public. Let's go over some statistical terms used in cancer registry. Incidence and death rates are age-adjusted and age-specific rates used to plan for cancer interventions. Confidence intervals reflect the range of variation in estimating cancer rates. Stage of diagnosis is determined by the SEER Summary Stage 2018 rather than age-ACC. MCR no longer collects age-ACC information, however, it is required by COC-accredited facilities. Relative cancer survival measures the proportion of cancer patients who will be alive at a certain period of time, such as 5 years. Cancer prevalence is the number of people with a specific cancer in a given population at a specific time. Differences can be found in cancer rates among racial and ethnic populations. Differences can also be attributed to variations in risk factors and health behaviors. The Missouri Public Health Information Management System, also known as MOFIMS, can be found on the MCR website under Data, Cancer Data. A direct link to MOFIMS is included on this slide. MOFIMS is home to the Missouri Information for Community Assessment Data known as MICA. MICA. This is the opening page of the Missouri Public Health Information Management System, MOFIMS. MICA is the Missouri Information for Community Assessment. Click on Data MICAs to start your query. The right-hand side of the screen shows the parameters that can be selected. Results can be displayed in a table or a graph. Information other than cancer can also be queried on MOFIMS, such as maternal, infant, and child health. I know when I was involved with cancer registry in the hospital setting, I always used information from the American Cancer Society and RQRS for creating the annual report. I was not aware of MICA until I started working at the Central Cancer Registry. This, in addition to U.S. cancer stats, are new resources you can share with your registry team. MCR Annual Report and One-Pagers. The MCR Annual Report can be found on the MCR homepage by scrolling and clicking on the View Annual Report button. It provides information about the top 10 cancers in Missouri with regard to incidence, mortality, and stage of disease. Prevention and screening rates are also included. MCR has produced a number of one-pagers on the top cancer sites in Missouri. The MCR Annual Report and site-specific one-pagers were created by our informatics specialist Vishwa Bayani. A childhood cancer one-pager was recently added to the MCR website. The one-pagers can be found under View Missouri Stats. We now have 13 site-specific one-pagers that are updated annually. ODS certification. I know we have already talked about education, but let's talk a little bit about the importance of ODS certification. Oncology Data Specialist, formally certified tumor registrar. Today, there are only 5,700 ODS professionals worldwide. There is definitely a need for more ODSs. The ODS credential demonstrates knowledge and professional competency in the cancer registry profession. COC-accredited facilities require case abstraction be performed by an ODS-certified registrar. NCRA's Salary and Compensation Considerations Report shows ODS-certified cancer registrars earning approximately $25,000 more per year than non-credentialed registrars. An ODS's salary is comparable to a certified coding specialist or a certified coding associate or certified professional coder. ODSs who work for contract companies generally earn more than those employed by healthcare facilities. Pathways to becoming an oncology data specialist. There are 3 routes individuals can take to obtain the ODS certification. Let's review the 3 eligibility routes. Route 1 includes successful completion of an NCRA accredited associate degree program and completion of the NCRA accredited formal education programs, practicum activities, and competency assessments in cancer registry management. Route 2 includes successful completion of an associate's degree or equivalent, 60 college credits, plus successful completion of an NCRA accredited certificate program in cancer registry management, and successful completion of the NCRA accredited formal education programs, practicum activities, and competency assessments in cancer registry management. All cancer registry coursework must be completed before beginning the practicum. Route 3 includes successful completion of any associate's degree or the equivalent of 60 college credits, and the coursework must include 2 semesters, a total of 6 total credit hours of human anatomy and human physiology, and 1,950 hours equal to 1 year full-time experience in the cancer registry field is required. In conclusion, we have reviewed the data quality standards required by our standard setters, the importance of timely and accurate reporting, who our reporters are, how death information and linkages are used, the importance of case consolidation, audits, resources for abstracting, the importance of education, and the education provided by Missouri Cancer Registry, and lastly, how the incidence data is used and where to find it. Cancer Registry is a journey of constant learning and adapting to changes in coding rules, not unlike coding in HIM. We work hard to provide education to our reporters and plan to host an annual MOODS educational conference on September 26th at Boone Hospital Center to provide education and give cancer registrars the opportunity to collaborate with each other. This in-person event will be free for attendees and meet the new in-person CE requirement. In addition, Missouri Cancer Registry is an internship or practicum site to several students per year. Most of the students are in health sciences, public health, or data science and analytics programs. We have also accepted HIM students from other colleges and programs who need practicum hours. The students have been great resources in helping us with projects and even simple case abstraction. We collaborate with other states and share ideas on how to make our processes more streamlined. Several MCR staff are on various MPCR, SEER, and NACER committees that review changes and make suggestions as they come about. We're happy to promote the Cancer Registry in any way that we can. These are the website resources used in this presentation: NACER, STOR, 2025 Solid Tumor Rules, Missouri Cancer Registry and Research Center, U.S. Cancer Statistics, MICA, CDC, NCRA, and SEER training. If you have any questions, please contact me at lahf5p@health.missouri.edu or call the Missouri Cancer Registry at 573-882-7775. Thank you for your time in listening to this presentation. I hope you have gained knowledge about the cancer registry profession and gained insight on the resources used and needed by the cancer registrars in your facility. I hope you have also learned about activities in the Missouri Cancer Registry. Feel free to reach out anytime.